Ministry of Home Affairs directs states and union territories to ensure strict compliance of lockdown measures, not allow social or religious gatherings. Ministry exempts operations of fishing and aquaculture industry from lockdown restrictions. Punjab government extends curfew in state till 1st May. PMO reviews efforts of 11 empowered groups to tackle COVID-19, meeting stresses on proper communication of MHA guidelines for better supply chain logistics. Also emphasizes need to communicate with people in regional languages. Prime Minister to hold video conference meet with chief ministers today. Health Minister Dr. Harshvardhan interacts with state health ministers to review situation arising due to COVID-19. Finance Ministry says government under process of releasing 12 million metric tons of food grain in 3 months under Pradhan Mantri Garib Kalyan Anna Yojana. And World Health Organization warns of possibility of deadly resurgence if stay-home restrictions are lifted too quickly, as global death toll due to coronavirus goes past 100,000, with more than 1.6 million cases registered worldwide. Hello and welcome to this edition of the news. I'm Rukmaina. Top story. The government on Friday once again reiterated it has found no evidence yet of community transmission in India. The Health Ministry in its daily briefing said the rate of infection remains low, with just 2% of 16,002 samples tested on Thursday testing positive. The Health Ministry further said there is a need of 1 crore hydroxychloroquine tablets, and the country currently has 3 crore 28 lakh tablets. Additional Secretary of the Ministry of External Affairs and Coordinator of COVID-19, Damu Ravi said 20,473 foreign nationals have been evacuated till Thursday. He said hydroxychloroquine is in high demand globally and many countries have requested it. He said, considering domestic stock availability and the country's requirement, the group of ministers has decided to release some surplus stock for export. The number of active COVID-19 cases in India now stand at 6,039, according to the Ministry of Health and Family Welfare. 206 fatalities have been recorded, and as many as 515 people have been cured and discharged, while one has migrated. The central government has exempted marine and fishing industry from the lockdown restrictions. Along with this, the government has also provided exemption to activities related to trading of fish. Although the centre has said that social distancing and cleanliness are to be maintained while carrying out trade in order to stop the spread of COVID-19. Union Health Minister Dr. Harshvardhan held a video conference with state health ministers to review action and preparedness of states to manage COVID-19. The Minister of State for Health, Ashwini Kumar Chaube, and senior officials of the ministry were also present at the meeting. Briefing the media, he said that 4,100 crore rupees has been released to states in this regard.
विशेष रूप से सुविधाओं को और ज़्यादा स्ट्रेंथन करने की दृष्टि से कोविड के खिलाफ लड़ाई को और मजबूत करने के लिए 15,000 करोड़ रुपए का एक हेल्थ डिपार्टमेंट के लिए पैकेज उसकी घोषणा की थी। मैं ये आपको बताना चाहता हूं कि उसमें से 4,100 करोड़ रुपया ऑलरेडी हम सभी स्टेट्स को रिलीज कर चुके हैं। पैसे के कारण किसी भी प्रकार से कोविड के खिलाफ जो हमारी जंग है उसमें कोई कमी नहीं आनी चाहिए, ऐसा हमारे प्रधानमंत्री जी की भी इच्छा भी है, उनका निर्देश भी है और उसके अनुरूप उन्होंने हमें हेल्थ डिपार्टमेंट को सहायता भी की है.
And Dr. Harshvardhan said that the ministry has issued an advisory to deal with hotspots and implement the lockdown properly.
काफी हद तक स्थिति को कंट्रोल करने में सफल हुए हैं. कुछ स्टेट्स के अंदर जरूर बीमारी थोड़ा सा असाधारण गति से आगे बढ़ रही है, लेकिन अभी लॉकडाउन के हम तीसरे सप्ताह में हैं. साधारणतः जो एपिडेमियोलॉजिस्ट का भी कहना है कि 2 से 4 सप्ताह तो इसके कर्व को फ्लैट होने में नॉर्मली भी लगता है। इसलिए हम जरा भी धैर्य को ना खोएं, परिश्रम के में कोई कमी ना रखें। जो टेक्निकल एंगल से जितने भी हमारे इनपुट्स हो सकते हैं उसको गहराई से हम करें, हर विषय पर पैनी निगाह रखें। और अब जबकि देश के अंदर स्वास्थ्य मंत्रालय, एनसीडीसी और सब प्रकार के एक्सपर्ट्स के माध्यम से हॉटस्पॉट्स को लोकेट कर दिया गया है, लेबल कर दिया गया है, उनके लिए स्ट्रैटेजीज डिफाइन कर दी गई हैं।
And Dr. Harshvardhan said that homemade masks may also be used to cover the mouth and nose to protect from coronavirus.
होममेड फेस कवर के बारे में बहुत सारी बातचीत हुई है। इसके बारे में भी अपने अपने स्टेट्स में लोगों को हम स्पष्टता करें कि हर एक व्यक्ति को सर्जिकल मास्क लगाने की कोई आवश्यकता नहीं है, लेकिन अगर हम अपने मुंह को कपड़े से, रुमाल से, घर के बने मास्क से या किसी भी इंडिजिनस मास्क से कवर करके रखते हैं बाहर जाते समय, तो ये निश्चित रूप से आज के माहौल में उनको कोविड से सुरक्षा प्रदान कर सकता है।
And the National Health Authority has launched express empanelment to bring a large number of private hospitals under Ayushman Bharat Pradhan Mantri Jan Arogya Yojana to ensure continued essential treatment for serious illnesses such as cancer and heart ailments. This is a significant follow-up call taken by the Government of India to its recent decision to bring testing and treatment of COVID-19 under Ayushman Bharat Pradhan Mantri Jan Arogya Yojana scheme as per protocol and guidelines of ICMR. Ministry of Health and Family Welfare and state governments. During the current situation of novel coronavirus outbreak, many medical colleges, civil hospitals and district hospitals which were otherwise treating bulk of ABPMJAY patients are being converted as dedicated COVID-19 facilities in states. With the launch of this new mechanism called Hospital Empanelment Module Light, patients suffering from serious illnesses such as cancer, cardiac issues and diabetes that require continuous treatment will be able to continue getting inpatient services without the fear of contracting the infection. The mechanism will also help in empaneling dedicated COVID-19 hospitals as well. Hospitals can empanel themselves for a temporary period of 3 months through a simpler, user-friendly online system available on the scheme's website www.pmjay.gov.in. News Broadcasting Standards Authority of India (NBSA) has issued an advisory to news reporters and agencies in respect of the interview of persons kept in isolation due to the COVID-19 pandemic in the country. The independent adjudicating body of news broadcasters has advised all reporting units of COVID-19 not to enter hospitals or isolation wards where COVID-19 positive cases are being kept in isolation to contain the transnational contagion. It is also advised not to interview medical personnel so as not to jeopardize other lives in the country. States across the country are ramping up efforts to contain and check the spread of COVID-19. Punjab government has decided to extend curfew in the state till 1st of May. The decision came after Chief Minister Amarinder Singh held a cabinet meeting through video conference. The cabinet also decided to promote class 5 and 8 students to the next class. The Union Territory of Ladakh is shifting gear in the fight against COVID-19, treating the positives, testing the symptomatics, effective implementation of the lockdown and making people adhere to restrictions by the administration to contain the spread of the virus in the region are the strategies here. The Union Territory of Ladakh's Health Secretary, Commissioner Rigzain Samphel, said that Ladakh has set up COVID-19 hospitals in Leh and Kargil with all necessary infrastructure. On procurement of essential commodities, Divisional Commissioner Secretary Saugat Biswas said that Union Territory Administration is also procuring fuel, essential commodities and vegetables to distribute to the public during the lockdown.
That's where we have been getting positive cases. But then also the credit goes to the leadership of the Honorable Lieutenant Governor, who's been reviewing this every day for at least 2-3 hours. Then obviously the public have been very cooperative. All our strictures of social distancing and confining themselves to the home, those have been actually followed, and this wouldn't have happened without the support of the public.
एयरफोर्स के हवाई जहाज़ों के ज़रिए से अब तक सब्जी और दूसरे एसेंशियल कमोडिटीज़ जो है दिल्ली और चंडीगढ़ से लाते रहे हैं और डेली कुछ ना कुछ हमारा सामान आता जा रहा है. सो वैसे भी लॉकडाउन ना भी होता तो भी अभी जो जिला बंद है तो दूसरे किसी और जरिए से आ नहीं सकता था सामान, तो वो सामान आ रहा है, लोगों में डिस्ट्रीब्यूट हो रहा है. तो जो ऑटोनोमस हिल डेवलपमेंट काउंसिल्स हैं लेह और करगिल के, वो डिस्ट्रीब्यूशन में हमारी बहुत मदद कर रहे हैं. और मर्चेंट एसोसिएशन है, कोऑपरेटिव डिपार्टमेंट है, दे आर एक्टिवली इन्वॉल्व्ड इन प्रोक्योरिंग द मटेरियल एंड सप्लाइंग द मटेरियल एट far off places.
The administration of the Union Territory of Ladakh has decided not to allow public and seasonal nomadic Gurjars to cross the Zojila Pass until further orders. The orders will prevail until normal situation is restored in the Union Territory. Secretary Commissioner Rigzin Sample said that the Zojila Pass will only be open for transport of essential goods in the region.
टेक्निकली जुजिला को बहुत समय से पहले खोला है और खोलने का उद्देश्य ये है कि जो ज़रूरतमंद सामान हैं जो कि हमारे एसेंशियल कमोडिटीज़ में आते हैं, सिर्फ उन्हीं के लिए हम लोग जो है जुजिला का रास्ता खोल रहे हैं. उसके बावजूद भी अगर अनजाने में कोई यहाँ आ जाता है, वैसे हम लोग आने नहीं देंगे, तो उसके लिए हमारा पॉलिसी ये है कि हम लोग 28 दिन तक उनको क्वारंटाइन रखेंगे. द्रास में हम लोगों ने टेम्परेरी क्वारंटाइन फैसिलिटीज़ रखे हैं. कोविड-19 के लद्दाख में कल 6 सैंपल्स के रिजल्ट हमारे पास आए हैं. सारे रिजल्ट्स नेगेटिव हैं और ये सारे जो सैंपल्स थे वो ले के थे. इसमें 4 हमारे तीर्थयात्री हैं जो कि ईरान गए थे, उनके सैंपल्स भी नेगेटिव आए हैं.
And amid a growing tally of COVID-19 cases in the country, people who have recovered from the disease have expressed gratitude to doctors. These corona warriors are urging people to stay at home.
बहुत अच्छा लग रहा है, यहाँ से खुश होकर जा रहे हैं हम घर हमारे परिवार के लिए. बस बिल्कुल अच्छा लग रहा है हमारा.
यहाँ पे हमारा बहुत अच्छा ख्याल रखा गया है पूरी डॉक्टर की टीम द्वारा, नर्सिंग स्टाफ, बाकी पूरे हेल्थ प्रोफेशनल्स द्वारा.
बहुत अच्छा लग रहा है. यहाँ के डॉक्टर ने बहुत सेवा करी है, हमारी बहुत ध्यान रखा है और हमने इस बीमारी से जंग जीती है. आप अपने घरों में रहिए, अपना ख्याल रखिए और सब सुरक्षित रहिए अपने घरों में.
And with rising number of coronavirus cases in the country, the forces have come together to fight the invisible enemy. In addition to the CRPF and police, the Indian Air Force is working shoulder to shoulder to supply essential goods to every citizen. In this fight, the Air Force's C-17, C-130, IL-76, AN-32 and Dornier aircraft today dropped essential loads at Mumbai, Bengaluru, Guwahati and Leh. Along with this, it also shifted army doctors from Lucknow to Guwahati. The Air Force is continuously working round the clock to ensure that items such as medical supplies and equipment, disinfectants and medical samples reach the desired destination to assist other professionals to fight against coronavirus. And the central government under the Pradhan Mantri Garib Kalyan Anna Yojana is in the process of releasing 12 million metric tons of food grain during April to June. Finance Minister has tweeted that the government will provide for 80 crore people food grain of 5 kg per head per month at no cost. Free ration has already reached 2 crore beneficiaries. The National Commission for Women has launched a WhatsApp number 72177 35372 on Friday to report cases of domestic violence which have seen a rise during the lockdown period. In a tweet, the NCW urged people to report such cases through messages on the number so that the agency can provide support and assistance to women in distress or experiencing domestic violence. The number has only been launched for the period of COVID-19 lockdown till normal offices resume. And the government's official fact-checking entity has debunked media reports which claim that the Ministry of Railways has issued protocol regarding passenger travel post-lockdown period. The PIB fact-check team tweeted that such claims are speculative and misleading. No such protocol has been issued by the government. The PIB has also dismissed media reports of shortage of hydroxychloroquine for Mumbai doctors dealing with COVID-19. PIB fact-check team termed the report as fake. More than 100,000 people have died worldwide from coronavirus, with nearly 70% of all fatalities in Europe. Data compiled by the Johns Hopkins University showed the global death toll at just over 100,000. And the number of confirmed cases worldwide at more than 1.6 million. More than 3,72,000 recoveries have been recorded. Italy has registered the highest number of COVID-19 deaths, more than 18,800 as of Friday, while the United States has reported the majority of confirmed infections, nearly 500,000. However, the number of newly hospitalized patients in the hardest hit state of New York has dropped to a 1% increase. The World Health Organization has warned countries to be cautious about lifting restrictions introduced to curb the spread of coronavirus. Director General Tedros Adhanom Ghebreyesus said the WHO would like to see an easing, but at the same time lifting restrictions could lead to a deadly resurgence. He said there had been a positive side of slowing of epidemics in some European countries, including Italy, Germany, Spain and France. However, he mentioned that there had been an alarming acceleration in other countries, including community transmission in 16 countries of Africa.
Some countries are already planning the transition out of stay-at-home restrictions. WHO wants to see restrictions lifted as much as anyone. At the same time, lifting restrictions too quickly could lead to a deadly resurgence. The way down can be as dangerous as the way up if not managed properly.
And the United States reported nearly 18,000 COVID deaths, and the total number of infections have touched the 500,000 mark. US becomes the first country to record more than 2,000 COVID-19 deaths in one day. New York, the epicenter of the pandemic in the US, has registered more than 7,000 deaths and over 170,000 cases, which surpasses Europe's worst hit Spain and Italy's infection toll. Meanwhile, President Trump has said that he is seeing a downward curve very strongly in New York, and a lot of that has to do with the aggressive strategy in saving so many lives. He also said that he would soon set up a new advisory council of doctors and businessmen to recommend when to open America, whose economy has come to a grinding halt due to the pandemic. More than 95% of the country's 330 million population are under stay-at-home orders as part of measures to protect people from catching the infection. In Turkey, Istanbul, Ankara and other major cities have been locked down for 2 days from Friday midnight to combat the spread of the virus. The restrictions were imposed in 31 provinces across the country and scaled up existing curbs under which people under the age of 20 and over 65 had been told to stay at home. As the lockdown was announced, people rushed out to buy supplies, forming long queues outside supermarkets. Turkish authorities called on people to maintain their social distance. The restrictions were imposed in 31 provinces across the country and scaled up existing curbs under which people under the age of 20 and over 65 have been told to stay at home as the country's death toll from the pandemic rose above 1,000. Brazil, the hardest hit Latin American country in the coronavirus pandemic, has crossed the mark of 1,000 deaths. According to Health Ministry's latest figures, 19,638 confirmed COVID-19 cases were registered in the country with 1,057 deaths. Meanwhile, in Amazonas, which is home to more indigenous people than any other state, was badly affected. 95% of intensive care beds were already occupied in the region. According to officials, a teenager from the Yanomami indigenous tribe was also among the deaths due to the new virus. And Spain has shown a record 4% low in death toll since last 17 days, with 605 people dying from COVID-19, taking the death toll to 15,843. The rate of infection has also slowed in the country, with 4,576 new cases over the past 24 hours, with the number standing at 1,57,022. An Ireland on Friday extended the stay-at-home coronavirus restrictions until the 5th of May. Prime Minister Leo Varadkar said the curbs had significantly slowed the spread of the outbreak, but more work was required to end it. Ireland has shut bars, restaurants and non-essential retail since March 27th. Meanwhile, Prime Minister also appealed to people not to travel more than 2 kilometers from their home or visit friends and family until this Sunday. Education Minister Joe McHugh also postponed the Leaving Certificate state school exams from early June until late July. Prior to the March 27th lockdown, Ireland had banned all non-essential travel within the country. Confirmed COVID-19 cases in Ireland rose to 8,089 on Friday with 288 deaths. However, the average day-on-day case growth has fallen to 9% from 15%. Italian Prime Minister Giuseppe Conte has refused to bow down to business pressure and extended the Mediterranean country's economically crippling lockdown until the 3rd of May. The announcement came after Italy's COVID-19 toll climbed by another 570 fatalities to 18,849, which is more than any other country, with the growth rate now just a fraction of what it was a few weeks ago. And in France, the death toll from COVID-19 has jumped by nearly 1,000, taking the death toll to 13,197, while a total of 90,676 confirmed cases of the disease have been registered in the country. In the UK, the death toll from COVID-19 has risen by 980 to touch 8,958, which is the biggest daily rise to date. The toll exceeded the deadliest day rise reported by Italy on March 28, the country worst hit by the virus. Meanwhile, UK Health Minister Matt Hancock has confirmed that Prime Minister Boris Johnson's health is improving after leaving a 3-night spell of intensive care. And in Poland, to ensure that basic facilities reach everyone, 7 vending machines that dispense face masks, gloves and sanitizers have been installed on the streets this week, and an additional several dozen of them are planned to be installed soon. The move, which is being much applauded, comes after Poland extended its lockdown measures such as closing schools, hotels, restaurants, shopping malls, cinemas as well as parks and promenades to contain the spread of the virus. As of now, 5,742 people have been infected with the virus in Poland, with 175 dead. The pandemic, which has infected over 1.5 million people worldwide, has begun taking its toll on economies, with people from various sectors facing the threat of losing jobs. Liverpool legend Sir Kenny Dalglish has tested positive for coronavirus and is in hospital but is showing no symptoms, his family announced. Dalglish was admitted to hospital on Wednesday for treatment of an infection which required intravenous antibiotics. The 69-year-old former Celtic and Scotland forward was routinely tested for coronavirus after he was admitted. Dalglish won the Scottish League title 4 times at Celtic before moving to Liverpool in 1977. At Liverpool, his honours included 8 league championships as a player and manager and 3 European Cups. Indian cricket captain Virat Kohli acknowledged the efforts of police in combating the spread of coronavirus. He thanked Delhi police for not just performing its duty but also providing food to the needy on a daily basis.
Hi, this is Virat Kohli. It is heartening for me to know that the police service across the nation is helping so many people in these difficult times. I want to acknowledge the efforts of Delhi police, who have not only performed their duties with absolute honesty but also taken food to the poor people on a daily basis, which is their utmost requirement. So well done, and keep putting in the same effort.
And Bollywood actor Ayushmann Khurrana, who is also known for his poetry skills, has penned a beautiful poem dedicated to the Corona warriors. Let's take a look.
वो सामने वाली बिल्डिंग कुछ दिन पहले सील हो गई और तब से आस पड़ोस के लोगों की ज़िंदगी थोड़ी तब्दील हो गई। उसी बिल्डिंग के नीचे वाली दुकान से तो घर का सामान आता था और वो बीमारी के बारे में कुछ दिन पहले बता देते तो क्या जाता था। आज हम डरे हुए हैं, जीवित हैं पर मरे हुए हैं। आज लगता है कि काश कर दें सब कुछ ठीक इस दुनिया को करके रिवाइंड। बट बिलीव मी, दिस इज नथिंग बट द कलेक्टिव कर्मा ऑफ ह्यूमन काइंड। सलाम है उसको जो सड़कें साफ करता है, कचरा लेकर जाता है, घर का सामान लेकर आता है और फिर अपने घर जाता है। पर हमने उसको वो इज्जत दी ही नहीं। हम पैसे वाले हैं, हमारे बाप का क्या जाता है। और वो बेचारा डरता है कि कोरोना वायरस उसके परिवार को ना हो जाए, वो अपने बच्चे को छू नहीं पाता है। ये अमीर गरीब का इंसानियत से परे का नाता है। इस देश को गरीब ही चलाता था, गरीब ही चलाएगा। हमें इस समय भी सब सुविधाएं गरीब ही दिलाएगा। अब जब ये सब ठीक हो जाएगा ना, तो इन लोगों को इज्जत देना। कोई काम छोटा नहीं होता, ये बात अपने पल्ले बांध लेना। आज डॉक्टर, नर्सेस, पुलिस, हमारा सिक्योरिटी गार्ड है सबसे ज्यादा काम के। और मुझ जैसे बॉलीवुड हीरो हैं बस नाम के। हम बस पैसे दे सकते हैं, हथियार दे सकते हैं, पर लड़ना उनको है। उन्हीं को सब कुछ सहना है। हमको तो सिर्फ घर पे रहना है। हमको तो सिर्फ घर पे रहना है।
And in a latest update, the number of active COVID-19 cases in India now stand at 6,565, according to the Ministry of Health and Family Welfare. 239 fatalities have been recorded, and as many as 642 people have been cured and discharged. One has migrated. With that, it's a wrap on this edition of the news. Namaskar.